This video's focus is on sinus series imaging. We'll cover the relevant CPT codes, common radiographic views, and walk through a sample radiology report to help improve your coding accuracy and documentation review skills. Let's begin. When coding for sinus radiographic exams, two primary CPT codes are used. 70210, radiologic examination, sinuses, paranasal, less than 3 views. This is typically used when only 1 or 2 sinus views are taken. 70220, radiologic examination, sinuses, paranasal, complete, minimum of 3 views. Assign this code when the imaging includes 3 or more standard sinus views. Choosing between these codes depends on the number of views captured in the exam. Always verify the number of documented views in the report. Standard projections for sinus imaging often include the following: paranasal sinus PA view, paranasal sinus AP view, paranasal sinus lateral view, paranasal sinus waters view, paranasal sinus reverse waters PA axial view. Let's look at a sample report to see how the documentation supports CPT selection. Header: AP and lateral views of the sinuses. History: retained foreign body in sinus cavity following a COVID swab. Findings: no radiopaque foreign body identified in the nasal cavity. Impression: negative for foreign body. This supports code 70210 as only 2 views are documented. The provider ordered imaging to rule out a retained COVID swab fragment in the sinus cavity. Since no foreign object was found, we cannot assign an injury code. Instead, we report Z0389 to reflect that the patient was evaluated for a suspected condition that was ultimately not present. According to the ICD-10-CM official guidelines for coding and reporting, codes from category Z03 are intended for situations where a person without a diagnosis is suspected of having an abnormal condition that requires study, but after examination and observation, the condition is ruled out. These codes are typically used in very limited circumstances and are not generally appropriate for inpatient admissions. In inpatient settings, if a condition is suspected but not confirmed, it's often more appropriate to code the signs and symptoms that prompted the admission. Important reminder: in diagnostic imaging, always code what is known at the time, typically the reason for the test, not the potential diagnosis being excluded. Example 2, order exam, sinus 3 views. Header: Waters PA, Caldwell PA, and lateral views. History: pain, concern for cherubism. Findings: no cystic change or lucent lesions, normal development of teeth near sinuses. Impression: no evidence of cherubism. This supports code 70220 due to the complete set of 3 views. Since the imaging is being done to evaluate pain with concern for cherubism, not a confirmed diagnosis, we must code the symptoms only, unless imaging or documentation confirms something more specific. This case documents only a concern or differential consideration, not a diagnosis. Correct ICD-10-CM code for example 2, R52 pain unspecified. This is an appropriate general code when the origin of the pain is unclear or not specified in more detail. Use when documentation only states pain without further context. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.